Good morning, everyone. My name is Jeannie Long. I am a senior specialist at Save the Children, and I am happy to welcome you to the Fresh School Health and Nutrition webinar series. Fresh provides monthly presentations by leading policymakers, researchers, and implementers engaged in improving the health and education of children in low and middle income countries across the globe. This month, we are commemorating World Toilet Day, and as a guest presenter, we have invited Catherine Pizzacala. She is going to present to us on the community-led school sanitation construction, improving sanitation infrastructure in hard-to-reach areas. Catherine holds a master's degree in development practice and a bachelor's degree in international development and political science. She has worked on WASH with a local NGO in Bangladesh and in Canada with the Water Health Nexus program of United Nations University Institute for Water, Environment, and Health. For the past 3 years, she has worked on WASH in schools in the Philippines as part of GIZ's Fit for School program, and we are very glad to have her here. So Catherine, I am going to unmute your mic. Please let me know when you'd like me to move the slides forward for you. All right.
Okay, hello. Thanks a lot, Jeannie. Morning and evening to everyone. I'm here from Manila, so it's evening for me. I hope everyone is still okay on the sound from my microphone. So as Jeannie mentioned, I'm going to present a bit about some work we did in the southern Philippines on sanitation construction and how this approach kind of evolved. So as you can see here on this slide, I think most people on the call probably already know about what a challenging reality WASH in schools is at school level. This is a photo of a toilet in Mindanao in one of the areas we're working in the Philippines, but it's not something that's uncommon in many schools with limited resources around the world. We know that half of schools don't have access to water, don't have functional toilets, and we know that school communities can often feel overwhelmed with a lot of different competing priorities. School heads often focused on, for example, implementing curriculum, but also have different programs and things to implement. So WASH might not always be a priority. Go to the next slide, please. So as we see in a lot of schools, can you click through? The reality is that a lot of schools don't have toilets at all, or might have limited toilets or limited access to water. They don't have any hygiene activities, and they often have very limited resources, if any at all, for WASH in schools. Sorry, I just see that Daniel's commenting that he can't hear me. Can everyone else hear me okay? Okay, it seems that the sound is okay for most people, so I'll carry on. I hope Daniel can rejoin us. But when we look at national standards, for example, expectations that are being set for schools by national governments, we see that there are minimum requirements they need to have for a number of toilets relative to pupils, facilities for water. They need to be providing safe drinking water and practicing hygiene activities. So for a school head or a school community, this can feel quite overwhelming, this stark gap. So a lot of the question then becomes, how do we get from there to here? Can you go to the next slide, please? So of course, the most feasible way to do this is to really start with small steps. So for example, a school might not have the funds available at the moment to construct the needed toilets, but they can start by cleaning the toilets they have and ensuring that that's integrated into a routine so that they can maintain functionality of the resources that they have available to them. Next slide, please. So this thinking is based on the 3-star approach for WASH in schools. This is an approach developed jointly by UNICEF and GIZ, and it really tries to provide stepwise guidance for schools towards reaching national standards. So it tries to break it down in concrete things that they can do to move on the road towards improving their WIN status. So for example, they can be recognized for different steps that they can take, which don't always require significant amounts of additional resources. You go to the next slide. So GIZ's Fit for School program uses a 3-star approach to work with government partners to implement the Fit for School approach. And so it's based on what we call the 4S principle. So it's simple, scalable, sustainable, and systems thinking. So the idea is that interventions in a WINS program should be developed in a way that they're simple, low cost, and that they can be absorbed by the system. So considering the resources that the system has available to them and their existing capacity, what is really feasible in that context. So in this way, keeping these two aspects in mind, WINS programs can be done on large scale and can be sustained over time. Can you go to the next slide? So this infographic gives a bit more detail about the Fit for School approach. So it's basically an integrated school health program that focuses on WINS interventions. So the emphasis here is really focused on practicing healthy habits and developing routines within the school rather than focusing on health education. So the aim is really to institutionalize WINS as a part of the school. So you can see in the center, the focus is really on hygiene activities. That's how the program really evolved. So for example, in the Philippines, initially the focus was on group hand washing, group toothbrushing, and biannual deworming. And of course, additional interventions can be added on using the same context. For example, improving drinking water access in schools by developing a system where children bring drinking water to school from home. That's then supported underneath by the section in blue. Of course, the infrastructure is also needed, so water facilities and toilets, also things like group washing facilities to allow for daily group hand washing. That's something that Fit for School program has really worked a lot to design low-cost group washing facilities for schools. So these then are supported by two aspects. On one side, the school community. So based on school-based management principles, this is through strong leadership from the school head and in engaging the other stakeholders. So particularly managing the teachers, but also working closely with the broader community. For example, parents and local government. Then on the other side here, you see school management, what aspects are particularly important to ensure that these things can be realized in the school. So for example, things like monitoring, not only to provide the information needed at higher levels for budgeting and decision making, but also for school heads to have to conduct self-assessments, for example, so that they can consider where they're at and identify concrete next steps to improve their implementation. You can go to the next slide, please. So this approach within GIZ is implemented in two main programs. One is the Fit for School regional program. So that's implemented in Laos, Cambodia, Indonesia, and the Philippines. There's also a second program called the ARMM program, which is the program that did the sanitation component, which we'll be discussing today. So the focus of the program was in part on institutionalizing daily hygiene activities in schools, also institutionalizing biannual deworming. We also worked on some support for school-based feeding. And then in addition to that, we had this sanitation component, of which there were two aspects. One was focused on cleaning and maintenance of toilets, and the other one was focused on actual toilet infrastructure. Sorry, next slide. So I should mention that this was done in the scope of a larger program called the BEAM ARM program. This was a DFAT-funded wider education program called the Basic Education Assistance to Muslim Mindanao. So there were several components implemented by different programs, or by different partners, sorry. GIZ worked on component 2 on WINS, and our component was co-financed by the Department of Foreign Affairs and Trade of Australia and the German Ministry for International Cooperation, BMZ. So this is the region that we were working in, the autonomous region in Muslim Mindanao, which we shorten as ARMM. So you can see on the left the box around the island in Mindanao in the south. And then on the right, you can see the part filled in green. That is the only part of Mindanao that, that comprises this region. So as it says in the title, it's an autonomous region, so they have a lot more decision-making power at regional level relative to other regions in the Philippines. And so within this context, we worked with the Department of Education ARM, so that's the regional office of the Department of Education. And so you can see a bit in the map here, for example, the islands in the center of the slide are quite isolated and hard to access. So it's somewhat of a remote region. It's also an area that has higher poverty rates and lower development levels relative to other parts of the Philippines. And this is also a place where there's been a history of conflict over the last decades. So it's in this environment that we were trying to implement and often unable to access many parts of the region. And it's also a situation that is still evolving. So the security situation was changing somewhat throughout the process of the program. Next slide, please. So it was in this environment that we took on this sanitation component. So together with DepEd ARM, GIZ aimed to improve toilets in 255 schools. So the focus of this component was really intended to be on rehabilitating toilets, so based on the Fit for School approach to look what was already there and try to improve it, rather than newly constructing toilets. In many schools that wasn't possible simply because some of them didn't have any toilets at all existing, and other schools, the toilets weren't, it wasn't feasible to rehabilitate them, so they needed newly constructed toilets. So this was initially implemented with a group of workers that were trained by GIZ staff and consultants that were from the region, and that would then travel in small teams to all of these 255 schools working on toilet construction. So this approach was somewhat successful, but also presented some challenges for us. Firstly, as you can imagine, in a politically sensitive environment, sometimes when there were perceived outsiders entering maybe construction teams that were from a different part of the region, there was some sensitivity with local communities. This approach is also somewhat costly. It requires having workers contracted over long periods of time, even when there are, for example, delays in implementation, and things like trucks to transport them around the region. And it's also somewhat time consuming because you have a limited number of team that need to travel to all of these schools. So this was implemented over a couple of years. And the challenge that we found as we reached the end of the program was really that there were 32 schools that were initially identified within these 255 target schools that were no longer accessible due to security reasons. So we had already implemented most of the component. We had these construction teams who couldn't get to the schools, and we had 32 schools remaining who had already been targeted for construction that we needed to support. So we discussed with DepEd ARM how to approach this, if we could choose 32 different schools to target, but they were quite insistent that we keep these 32 schools for a couple of reasons. One, because in this kind of environment that's somewhat hard to reach, sometimes they tend to be less prioritized for types of programs. And at the same time, they had already been informed that they would receive toilets at the start of the program. So they had been also waiting and anticipating and preparing the school community to receive this toilet construction. So they felt that at this time we couldn't change the target schools. Can you go to the next slide, please? So it was in this environment, facing this dilemma of how to still provide toilet support for toilet construction to schools where we couldn't access, that this idea evolved of community-led sanitation construction. So it was really based on the thinking of to look into the communities and see what capacity was already existing and could be strengthened to support toilet rehabilitation and construction. It is also strongly based on school-based management principles that the school head would really need to play an important role in managing the construction and ensuring that it was complete. Can you go to the next slide, please? So how did it work? So school heads from these 32 schools, at the end in total there were 35 schools. These school heads were given a set of criteria and guided with the type of person they could look for in the community, who could be a community skilled worker and would be able to commit some time to this project. So school heads identified them. Then they were brought to a 10-day training where they were trained by the construction teams on the toilet design, and they actually did an on-the-job training constructing toilets in some neighboring schools. The school heads were also brought in for a 2-day workshop on how to manage the overall implementation. Next slide, please. So the construction materials were provided by GIZ. They were handed over to the school heads directly and transported to the schools, and some of the basic tools that were needed were also given to the schools. Next, please. So the schools were also requested to provide counterpart in this case. So the school had then had to go back to the communities and conduct some resource mobilization. So, for example, they had the skilled worker who would be trained, but they would still need some additional labor to support the construction. So we had varying experiences with this. In some schools, of course, some school communities are very engaged in the school, and some school heads are very good at getting volunteers involved, while others seem to struggle with it a bit more. Can you go to the next slide? So the regional office, DEPA ARM, also provided an incentive of 10,000 pesos or 200 American dollars to motivate the schools to complete the construction. So they would send monitoring teams to the schools and request reports from the schools to validate the completion of the construction, and then would release 10,000 pesos for the use of the school. Next slide. So the monitoring was quite an intensive component of this intervention. So at the division level, which is the Department of Education level between the regional office and the school, there are physical facilities coordinators. Those are the people that are responsible for all of the infrastructure in the schools in the division. So they conducted monitoring and inspection of the toilets with support from GIZ. Then at the same time, the regional office, as I mentioned, sent a monitoring tool to each school on a couple of occasions to continue following up and continue to motivate them to complete the construction. And then finally, the final monitoring was also done together with the regional office and then some additional beam arm partners who also supported in validating the school's reports. So we also try to take quality control into consideration as much as possible. So first of all, guiding the school heads in the selection of the person who was to be trained was an important first step before the trainings even began, to have the right type of people with the necessary previous experience. And then ensuring that the training, particularly the on-the-job training in the schools, was really sufficient for them to fully understand that they could accurately implement the design. And then, as I mentioned, the physical facilities coordinators took on the responsibility for really doing the inspection upon completion to ensure the toilets were really functional. And then finally, as I mentioned, the regional office conducted several rounds of monitoring, or a couple rounds of monitoring, and then together in one instance with the beam arm team. Next slide. So the results showed some potential. Of the 35 targeted schools, 32 were able to complete functional toilets within 8 months. 3 schools did not use the materials for other infrastructure projects, so they diverted it to other needs that they had on the school grounds. Next slide. So we can see several advantages and challenges with this approach. So in the short term, of course, it increases the number of schools with functional toilets. It's also quite promising as an opportunity to reach schools that are in hard-to-reach areas that have often been previously, let's say, somewhat neglected or not chosen as program beneficiaries, maybe from special interventions because they are more difficult to access. And when we consider the SDGs and the need to really reach every school, this type of approach could potentially help to reach more inaccessible schools. At the same time, it produced a pool of trained workers on toilet construction that could also support each other. So in that way, then the division, for example, would have people who had some technical knowledge and could be tapped, for example, for repairs of the toilets they had done in those schools. And we found that it does have the potential to reduce costs. In our experience, just comparing the two, it was about 1/4 less expensive to do the community-led approach compared to the approach we were previously implementing, having the teams going school to school. Because of course you have the schools themselves contributed the labor, and then you also don't need to be bringing teams from school to school paying for transportation, accommodation, etc. Next slide, please. So unfortunately, this intervention was implemented somewhat towards the end of the ARMM program, which officially ended in June 2017. So we didn't have any opportunity to do a longer term evaluation, which would have been very interesting. But we do see that there are some potential long-term implications. So for example, community workers are already readily available in the school that already know how the toilet was constructed and can be tapped for doing basic repairs that are needed by the school. We also see that there could be potential, for example, relative to the other approach that would improve ownership. For example, creating more demand, let's say, for cleanliness from parents or households where somebody volunteered their time to contribute to the labor of the construction of the toilet. It might create also that kind of awareness about WASH within the community and could also raise demand, for example, for water access or additional toilets in schools. Next slide, please. At the same time, there were also some challenges we experienced in the approach. So, for example, some schools did not start construction right away. It really took some follow-up from the regional office to really ensure that the schools were starting construction. And I think until they made the first visit to those schools, that was really a boost in the implementation. But there was really a challenge at the onset getting things going at school level. It's also an approach that requires a high level of community participation. So of course, for some schools, like I mentioned, with very active parents and things, that can often be easy. Also in the Philippines, there is that tradition of parents regularly helping out and volunteering their time to do repairs at schools and things. So that was more easily leveraged maybe than in some other contexts it could be. But of course, there are still schools that could find it burdensome to motivate that kind of the needed volunteer hours in the school. As I mentioned already, there were also 3 schools that diverted materials to other projects rather than constructing the toilets. And as I mentioned also about the monitoring was really intensive. It really took the regional office a lot of time and energy, also the division office, to go and visit the schools regularly to do the needed follow-ups and the needed guidance for the schools. Next slide. So these are just some lessons learned that we compiled basically on feedback from our partner. So DEP at ARMM really mentioned that for them it was very important to position this 10,000 peso reward really as an incentive, as a recognition, a reward for the school, and rather than more as a payment for services. This is in the context of thinking that a healthy learning environment is part of the responsibility of the school community. And so they really wanted to emphasize that this funding was more of a recognition of their achievement. It was also noted by the school heads that they felt that having the materials already provided for the schools was really a catalyst for the school communities to come involved. So that was something very tangible that they could see at school level, that where they could have a PTA meeting, look at these materials and saying, okay, how can we go about implementing it? We've already been given half of the effort type of thing. Next slide. So it was also emphasized after the training that it was important, the work that was done with the workers. There was a couple days on orientation, and there was a bit about WASH more generally and why WINS is so important, more so for the community and keeping their school children healthy and their role as part of the school community. And they found that that was very important to see this not just as another job, but to see it as really a contribution that they're making to the school. It was also noted that it was particularly helpful to link the workers together, so to train them as a group so that they also have support among themselves, let's say between two school communities that are nearby, and that they can also work together in the future. They also discussed some ideas about how they could support also toilet construction in communities and things like that. Next slide, please. So moving forward, the Department of Education is quite eager to expand the approach to other provinces. So in particular, they're interested to look at some of the islands that are more remote, that sometimes programs have difficulty in accessing because of their location. At the same time, replication in other contexts is also needed for us to better understand the opportunity and limitations of the approach. So as I mentioned earlier, that we would assume that there are some longer term implications that would make this, for example, a more sustainable approach, but we would need to understand it better in different contexts and have a more longer term evaluation. Next slide. So I just want to, before I conclude, also draw attention to a tool that's available as a result also of this component. It's a toilet repair manual, and it was developed also for this same region. It's intended for low-income schools that it can provide low-cost solutions for toilet repairs. So it covers basic things like, for example, door locks or beautification, ventilation, and also some more complex topics like wastewater management. So that is available on our website. If you go to the next slide. Here, fitforschool.international, and there's also more tools that were developed for the program on Washington schools there. So with that, I will thank you for your attention and your interest. And I think we can conclude or can proceed to the discussion section.
Thank you, Catherine. I have 4 questions. Starting with Doug's question, which I think you kind of already answered, and I have a related question. He said, were the costs comparable between community-based and trained workers going to all the schools? And I think you mentioned that it was a quarter less through the community-based intervention. And then I guess related to that, I wanted to know, so number 1, do you have anything to add to that? And number 2, did you notice any difference in the quality of the construction when you had more community support, or parents and community members volunteering? So that's first question, 2 parts.
Okay. So yeah, as I mentioned, it was a little bit less expensive to do, from our experience doing the community-based. Of course, it's much more affordable for the school to bring in labor than for GIZ, for example, to contract people to do it. So that kind of thing brings costs down. There was also a lot more counterpart from the regional office, the division office, and the school in this approach. And then just the basic costs of bringing people around school to school can really add up. On the second question about the quality of construction, I think it was more that in the community they needed more guidance and it was a lot more time consuming. So for example, the physical facilities coordinators had to be much more involved than they were in the previous design because the schools needed a bit more technical support, a bit more guidance. And of course, it took much longer to implement, whereas the teams who go school to school are so used to constructing this type of toilet when they're doing it for the first time, when they need to mobilize the labor, and maybe people aren't available for an entire day at a time, it was more time consuming per school, I mean.
Okay. The next question came from George Yap, and he asked, what were some of the key criteria used to select suitable CSWs? In selecting schools, apart from need for infrastructure, were there any considerations re schools' capacity or their commitment to provide ongoing operations and maintenance, including annual budget commitments? So 2 questions in one for you again.
Okay. On the first question, I would need to go back to our WASH engineer who developed the criteria. I know that there was the intention to try to balance what would realistically be available in these communities with the technical need, but I can't answer accurately that question off the top of my head. I would need to check with our WASH engineer. On the second question, in selecting schools, the criteria was about a few things. One was accessibility. The second part was their involvement in another part of the program. We worked on the essential healthcare program. So that was the daily hygiene activities. So if they were already practicing daily group hand washing, group toothbrushing, biannual deworming, that was also a requirement. And then it was also that it prioritized school heads who had undergone a training on leadership. So it looked a bit at the school head's ability to manage these type of things. Regarding annual budget commitments, that lies more with the regional office. These schools at the moment don't have operating expenses budgets, so they're a bit limited in their ability to budget at the moment because they don't have school level budgets.
Okay,
so
and
it looked more,
sorry, go ahead.
Just to add, it looked more at the school head's ability to create a system and to manage things, and let's say to mobilize stakeholders and do kind of resource mobilization than it did specifically at their budgeting.
Okay. And then Doug asked, is the DepEd responsible for providing clean water to schools, or is it another ministry such as a municipal authority?
Yeah, I believe the responsibility lies with the local government units, the LGUs, and then the school heads are responsible for the coordination aspect of it, for reaching out to the LGUs and making the request.
And Sung asked, have you had a chance to go back to see how the toilets are being maintained and used? I know you mentioned this happened at the end of the project, and so you didn't have as much time to see the long-term impacts, but do you have any anecdotal evidence about how they're about the operations and maintenance thus far?
Unfortunately, I don't. I myself have not been to this particular area of ARMM because of the security restrictions. I think it would be really interesting for us to do a very simple kind of anecdotal feedbacking through the division. They're the ones that really have the access and would know themselves also the reality there. I think at the moment the division is a bit, I think many people have seen in the news, the Marawi crisis. This is the same area that in the last months has been dealing with a conflict in the major city in this province. So at the moment they're a bit in recovery mode. But I hope it's something in the next year that Debit Arm could take on to really look into, and especially considering that they now want to expand the approach to try to do a bit of a comparison with the more traditional approaches they've been using to see what would fit best in different contexts.
Okay, and we have a new question from Daniel who asks, what's the role of students in all of these processes?
So we did a wider intervention to support student leadership in WASH. So as part of the essential healthcare program, the daily hygiene activities and things, there was an effort to really encourage students to take on the role of what we call hand wash champions. So to be the ones leading daily exercises and things, and leading, for example, toilet cleaning in schools that do that with students, or to lead, for example, children going outside to do hand washing to try to minimize the burden on students. There's also orientation done for all of the teachers about orienting the children on proper toilet use, for example. And we also distributed materials. We have some actual materials available now, just little kind of infographics about how to use the toilet, how not to use the toilet, that kind of thing. So we distributed some materials for them also to post in their classrooms about what can I do to keep my school a clean and healthy place.
Okay, and it looks like we have another question coming in. What happens when there isn't water at school for hand washing or for flushing and cleaning the toilet?
Yeah, this is one of the biggest issues throughout the program. On all of the interventions, we tried to do that. In many of the schools, there isn't water. So it's a really big challenge for Debit Arm and for the schools themselves in trying to implement these basic things, and trying also to prioritize where they use the limited water that is available. In this intervention, as part of the training for the skilled workers, there was also a portion on rainwater catchment systems, how to design a simple one and install it along with the toilet so that they could have a bit of water used basically for toilet flushing, because they're poor flush toilets. So we tried to support in that way, and then also through, not specifically through this component, but through other components, we also encouraged children for the schools to encourage children to bring water from home, that there is a bit of water on school grounds.
Was that for drinking water?
Yeah, that's for drinking water. But they also, for example, for hand washing, they also had some systems where it varied by school, but they had some systems where the teacher would assign one child to bring water, for example, for that week for hand washing.
And then some followed up with, are there any considerations for other types of latrines that don't require flushing with water?
Yes, there were. I wish I could discuss this in more detail because I wasn't involved in the time that the toilet design was being done. But I believe that they tried some different models, but they found that that schools were less accepting of toilets that didn't resemble the ones that were currently available or that were currently being used in toilets in schools, and that poor flush was kind of what they saw as acceptable, and like what they perceived as like clean, let's say.
Okay. Do we have any other questions? Sung is sitting next to me, and she says she has a follow-up question. Maybe I'll let her unmute herself.
So I understand the desire for the flush toilets, but if the desire for the flush toilet is there, but that there's a big lack of water, was there any effort to bring those two very different the needs and the actual ability to put in flush toilets versus aspirations. And was there any discussions about that? Were there any efforts to see if there was some like compromise, since putting in flush toilets and not having water doesn't seem to be helpful either?
Yeah, I see your concern. I think that I know that there was a lot of discussion done. There was also modeling of different
Am I
designs
on?
done. Yeah.
Okay, great.
I wasn't in the program at that time, so I can't comment on the details of the discussion. It was done years in advance of this part of the component. So I can't comment in too much detail how they exactly arrived at that. But I know that they also tried to model it similar to the DepEd standard toilet design, which is pour flush toilets.
Yeah, I think that's been a common challenge in other countries as well, where the national standard doesn't match with the environment where the toilets are. So, um, so just want to open it up, make sure if anyone has any other questions, you're also free to unmute yourself if that's easier. And give it a couple seconds, and if not, then we'll give everyone 15 minutes back for their day. So, oh, Doug McCall is typing a message. Great. So before I end the presentation, I want to thank Catherine for her time and for putting this together for us. It's always good to see the experiences in other locations and see how they compare to places where we work. This is the last webinar for the year. The next webinar will take place on February 15th of 2018. We'll confirm the time. And if you are interested in any topics in particular or in presenting, please reach out to Franco in the email and the invitation that was sent. We'll be happy to take suggestions and also appreciate hearing from others in the field. So everyone have a happy holiday, and thank you again, Catherine. And you will hear from the Fresh Schools webinar in 2018.
Great. Thanks a lot, Jeannie. Thank you, everyone.